£600 each year, an extra £6,150 annually. Is your wage going up, by the way? At least half of nurses at each NHS organisation and trust need to vote in favour of industrial action for the strikes to go ahead locally, which could trigger varying levels of service across the country. Joining me on the show right now is Julia Taylor, who is an NHS psychiatric nurse. Thank you very, very much. Now, I'm not 100% sure whether or not you were balloted. I'm hoping you can tell me. If so, are you going to go on strike? Do you support a strike? Talk to me.
No, I don't support a strike, and no, I'm not going on strike. And yes, I was balloted. I was asked by Unison if I wanted to strike, but I've thought about this and I haven't actually sent the reply back. I just thought I'm not doing it. And that to me counted as my no. But really, looking back on it, I should have said no, so they're clear that that's my intention. I won't strike. However, I certainly won't condemn anybody for doing that, because it's not just about the money, Patrick. We're very short-staffed. We're having to use agency nurses that might not know that particular job, that speciality. So we're having to do extra work. We're finishing late. Sometimes we're starting early. We're not attracting nurses into the profession at all. Student nurses leave their nurses training with £60,000 worth of debt. I mean, can you imagine starting your life off with £60,000 worth of debt? Why would anybody want to be going to that profession?
Julia, I've gone on record and said that I do think one way of trying to help out with a staffing crisis and a recruitment crisis is to do something nationally where we don't make student nurses pay fees, right, for university fees. I don't think there'd be a massive pushback across the nation for that. That seems to me to be an obvious recruitment drive that could actually help sort us out. I am bang against the strike, and the reason why I'm bang against this strike is if I went on strike, no one would really notice, and certainly no one would die, right? But if someone can't get chemotherapy or dialysis, say, that's catastrophic as far as I'm concerned. And I can't help but say, no matter what I think the reasons are, they'd have blood on their hands if they went on strike. Your thoughts?
Yeah, I'm not so sure if is that actually true, because I haven't heard that the people having chemotherapy and things like that
potentially it's one of the areas. It's one of the areas that they're saying would be, quotes, non-urgent, because they're not really. Well, some people would be in ICU if they needed chemo, obviously, but some people wouldn't be, and some of those areas would fall short of the urgent care that wouldn't be affected.
Yeah. My issue is, how many times are we going to have to do this, though? Look at the rail workers. They've been on strike day after day after day after day. And that would be, if I went on strike, that's 4 patients I wouldn't see in that one day. And that's like, if we do it day after day after day after day, that's 4, 8, 12, 16 patients just by having 4 days off on a strike. It's crazy. I can't bring myself to do it. I can't bring myself to go on strike, because sadly the government in a way have got us over the barrel because of people like me, and people might call me spineless.
I don't think you're spineless at all. I don't think you're spineless at all. I think you're an absolute hero. And there is this difference between, I don't not want nurses to be paid well for the job that they do. I mean, you'd have to be, an out-and-out Satanist, frankly, to not want people who save lives to be paid well for the job that they do. Don't get me wrong, but the idea of walking out when the ramifications of that could mean that people's health suffers, I think that moves the dial a little bit, and I think that changes the nature of what we're talking about here. One of the big things I'm keen to get your take on is this idea that we owe nurses because of what happened during the COVID pandemic. Now, great work was done there, worked through a pandemic, must have been an absolute nightmare, don't get me wrong. But at the same time, the nation did lock down. People did suffer financially as a result of that. People didn't see loved ones as a result of that. And the idea that the only people who really suffered during the coronavirus were nurses or medical professionals, I think is a bit inaccurate. And I just wonder your take on whether or not the rest of the nation now owes nurses money because of the way that the pandemic unfolded.
I don't really necessarily agree with that. The shop workers, people going to people's houses delivering food, takeaways, they all stayed open as well. Where's their pay rise?